And topography of the neck and fascia. Superficial muscles of the neck are Musculus Platisma and sternocleidomastoid muscle. Platisma, that is most superficial muscle of the neck, it starts from the region of clavicle and attached to mandible and to the skin of the lower lip, of the chin, that is Musculus Platisma. Sternocleidomastoid muscle, Musculus sternocleidomastoidus. Here it is the same, sternocleidomastoid muscle. That is the largest muscle of the neck, participating in flexion in the cervical department of vertebral column and extension in atlanto-occipital joint, and also participate in lateral movements. Medial muscles of the neck, they subdivide into muscles below of hyoid bone and above of hyoid bone. Below of hyoid bone we have omohyoid muscle. It starts from scapula and attached to hyoid bone, and this muscle subdivides with the help of intermediate tendon into two ventral, inferior and superior. Sternohyoid muscle start from sternum and attached to hyoid bone. Sternothyroid muscle from sternum attached to thyroid cartilage of larynx. And continuation of this muscle is thyrohyoid muscle, Musculus thyroidus, between thyroid cartilage of larynx and hyoid bone. And muscles above of hyoid bone, they are digastric muscle, Musculus digastricus, consists of venter posterior, venter anterior, and these two venters joined with the help of intermediate tendon which attach to hyoid bone. Stylohyoid muscle, Musculus stylohyoidus, the same attached to hyoid bone. Mylohyoid muscle, Musculus mylohyoidus, start from mandible attached to hyoid bone. And last muscle, impossible to see, it is above of mylohyoid muscle, start from chin and inner surface of mandible and attached to hyoid bone, Musculus geniohyoidus. What is the function of all of these muscles? Muscles above of hyoid bone moves mandible downward in time of mastication, for example, or in time of speech. And in this case, muscles below of hyoid bone fixed hyoid bone. That is why both of them, above and below of hyoid bone, participate in mastication. But muscles above moves mandible downward, and muscles below fixed hyoid bone. And deep muscles. Deep muscles of the neck consist of three scalenus muscles, Musculus scalenus anterior, Musculus scalenus medius, and Musculus scalenus posterior. All of them start from transverse processes of cervical vertebra and attach anterior and medial muscle attached to the first rib and posterior muscle attached to the second rib. If you remember, first rib has tubercle in place where anterior scalenus muscle attach. That is tuberculum musculi scaleni anterioris. That is place where anterior scalenus muscle attach. Between anterior and medial scalenus muscles we have space, that is interscalenus space, spatium interscalenum. That is place where subclavian artery and brachial plexus pass. And in front of anterior scalenus muscle we have spatium antescalenum, in front, antescalenum. Here it is subclavian vein pass. Another deep muscles, Musculus longus colli, between bodies and transverse processes of cervical vertebra, flexion of cervical vertebra. Musculus longus capitis, attach in the region of base of the skull and participate in flexion in atlanto-occipital joint. Musculus rectus capitis anterior and Musculus rectus capitis lateralis. The same flexion and lateral movements to the right and to the left in atlanto-occipital joint. They are muscles of the neck. Now topography. Neck subdivides into four regions. Anterior region, that is everything what is in front from sternocleidomastoid muscle, it is anterior region. Next region, that is region of sternocleidomastoid muscle, regio sternocleidomastoide, in projection of this muscle. Next, lateral region, between sternocleidomastoid muscle and trapezius muscle, lateral region. And posterior region, it's correspond to trapezius muscle. Here it is musculus trapezius, and that is posterior region of the neck. Anterior and lateral regions subdivides into triangles. In lateral region, we have two triangles. Omoclavicular triangle, trigonum omoclaviculare, between omohyoid muscle above, sternocleidoid muscle in front, and clavicle below. Omoclavicular triangle. And omotrapezoid triangle, trigonum omotrapezoidum, between omohyoid muscle, trapezius muscle, and sternocleidomastoid muscle. In anterior region, that is in front from sternocleidomastoid muscle, we have trigonum omotracheale, between omohyoid, sternocleidomastoid muscle, and trachea. Trigonum caroticum, carotid triangle. It is common carotid artery path, that is why it has name trigonum caroticum. Between posterior venter of digastric muscle, superior venter of omohyoid muscle, and sternocleidomastoid muscle, trigonum caroticum. Next, submandibular triangle between venter posterior and venter anterior of digastric muscle and mandible. Here it is, trigonum submandibulare. And in last triangle we have smaller triangle, lingual triangle. It's between posterior border of mylohyoid muscle, venter posterior of digastric muscle, and superiorly hypoglossal nerve. It is absent, hypoglossal nerve. In this triangle, lingual artery pass, and we can tie this artery in time of operation. Come here, fascia of the neck. Transverse section of the neck, that is skin of the neck. It is skin. And the cervical vertebrae. It is spinal process, bifid spinal process, then transverse process with two tubercles, body, vertebral foramen, that is opening in transverse process, cleatis. Under the skin, most superficial fascia. It has a name, Fasciae collis superficialis, superficial fascia of the neck. Fasciae collis superficialis. It's a round whole neck, and it's include musculus platisma. Platisma is inside of this fascia, musculus platisma. That is musculus platisma. That is why first fascia, Fasciae collis superficialis, number one, and it's round, letter A, musculus platisma. Second fascia, that is Fasciae colli propria, and it consists of lamina superficialis and lamina profunda. Lamina superficialis, Fasciae colli propria, attached to transverse process and fused with spinal process, and it is the same with transverse and spinal processes. And this fascia surround sternocleidomastoid muscle here and here, sternocleidomastoid muscle, and it is trapezius muscle, musculus trapezius here and musculus trapezius here. That is second fascia, lamina superficialis, Fasciae colli propria, and it has letter B, musculus sternocleidomastoidus, and letter C, musculus trapezius. Sorry. third fascia. Lamina profunda, deep layer. Lamina profunda, fascia colli propria. It is only in anterior region of the neck. It's fused with superficial layer, and it's around. It is laterally, that is omohyoid muscle, musculus omohyoidus, letter D, and it is musculus sternohyoidus and sternothyroidus. It is letter E, and that is letter F. Oh, it is the same. Sternothyroid muscle and sternohyoid muscle. And this one is omohyoid muscle. That is third fascia, fascia lamina profunda, fascia colli propria. Fascia number 4, fascia endocervicalis, number 4, fascia endocervicalis. And this fascia consists of parietal layer, which is surround all organs of the neck. They are larynx or trachea, pharynx or esophagus, and vessels and nerves. It is trachea, it is esophagus, it is vessels and nerves. Parietal layer of fascia endocervicalis and visceral layer, which is surround each of these organs. Visceral layer here and here and here. That is why I put here 4.1, that is parietal layer, and this one 4.2, that is visceral layer of fascia endocervicalis. And last fascia, that is prevertebral fascia, neovertebral column, fascia prevertebralis, that is fifth fascia, number 5, fascia prevertebralis, and these fascia surround deep muscles of the neck. They are scalenus muscles, or musculus longus colli and longus capitis. What is last letter? F, G, letter G. Deep muscles of the neck. Clear it is? And last moment, spaces between these fascia. First space between superficial and deep layer of fascia colli propria, and name of this space is spatium, interaponeuroticum, between two aponeuroses. It is not very good because it is not aponeurosis, they are fascia, but it has name interaponeuroticum. Fascia, spatium, interaponeuroticum, suprasternale, above of sternum, suprasternale, suprasternal space between superficial and deep layer. Second space between visceral and parietal layers of fascia endocervicalis in front of trachea, that is spatium pretracheale or previscerale, in front of organs, previsceral space. And last space between fourth and fifth fascia, that is retropharyngeal space, spatium retropharyngeale or retrovisceral space, or retrovisceral. That is both name, it is possible used retropharyngeal or retrovisceral. It is pretracheal or previsceral space. This diagram is present in your textbook. Please give me Yes, here it is. Maybe small moment. Here it is. Superficial layer should fused with spinal process. Here it is fused with spinal process. All another that is correct. You should draw, and here it is deep and superficial layer fused together. Here and here, superficial and deep layer the same fused together. That is why more better to draw like here. This diagram you need to draw in time of classes, in mini exam, in final exam. That is why next time I ask you this diagram with names of muscles, with names of these spaces, and muscles and topography of the neck. Next time. That is all.